A local nurse practitioner tells us he has seen more cases of a stomach virus here in East Tennessee. And, of course, as we get together for parties and other events, it's important to protect yourself. Brian Stanley, a nurse practitioner for Summit Medical Group in Karns, is here. So tell us what you're seeing in the office.
You usually see a variety of different severity with the stomach bug, which we call gastroenteritis, usually viral. It's just a little more severe than usual, I think, as far as the symptom severity.
When did you start seeing it?
Over the past couple weeks.
All right. And it's always bad when you get a stomach bug. What are the symptoms that you're seeing?
Well, with just the more benign stuff, I mean, you're going to have just feeling kind of achy, maybe kind of feverish, diarrhea usually, maybe vomiting. If you have more vomiting or abdominal pain, higher fever, or if it persists for several days, blood in your stool, those are signs that it could be something more serious.
So when do you need to go to your doctor, and when can you just do bed rest and fluids and things like that?
Give it a couple days. If you're not uncontrollably vomiting and you can keep down some fluids, you can just kind of watch it. If any of those symptoms that I just mentioned are present, you may want to just get it checked out if they're still present within a few days.
So what do we need to do to stay healthy this time of year? I know it kind of goes in waves, people getting sick, people you're around. What advice would you have?
I mean, it's pretty simple. If you can avoid crowds, you want to try to avoid them, because the more you're around people, you're just exposing yourself. For example, if somebody has one of these viruses we're talking about, and they touch a grocery cart, you go right behind them and pick up that germ. So, if you can decrease your exposure, but obviously it's the holidays, you want to get out there and have fun. Just wash your hands, good hygiene, antiseptic wash for your hands, those kind of things.
Now, is there something you need to do to treat children differently that are sick rather than adults?
It's pretty similar. One thing to watch out for with little kids, smaller children, especially infants, they can get sicker a lot faster than we can and get dehydrated sooner. They can lose that fluid volume easier. So, watch for them to not be making any tears, decreased urine output. And if they just look bad, they just look lethargic and sick, especially, like I said, uncontrollable vomiting too.
Same thing with elderly?
Yeah.
Okay.
Yeah.
All right. Well, thanks, Brian Stanley with Summit Medical Group. We appreciate it.